taking time for your health. The African American Wellness Watch. Trusted information for us, by us. Dr. Mike Lenore and other experts from around the country and around the world have the latest on how you and your family can get healthy and stay well. It's time for the African American Wellness Watch. Welcome to the African American Wellness Watch. I'm your moderator, George Strait. Diabetes. Our mothers and grandmothers weren't wrong when they said it was like having too much sugar. And at its base, diabetes is a chronic disease that affects how much your body processes and how it does process sugar. And we have too much of it. We are 60% more likely to have it than whites, 2.5 times more likely to be hospitalized with it, and twice as likely to die from it. Not only that, but diabetes is really more than just one disease. So what do we do? Well, we've got the experts to help us. Our host, Dr. Michael Lenore, who's a practicing physician for more than 40 years and former head of the National Medical Association. And Dr. Lenore Coleman, an expert in diabetes prevention and care and founder of Healing Our Village. Thank you both for being here. Dr. Lenore, how is diabetes more than just one disease?
Well, diabetes is more than one disease simply because there are so many systems associated with it. We're fortunate, as I say, to have Dr. Coleman, who's one of the world's experts in diabetes in the African American community, and she can tell you that diabetes affects almost every system. It can affect your kidneys, it can affect your brain, it can certainly affect your eyesight as well. So it's kind of a base of pathology that leads to a number of diseases in a lot of systems.
So let's go to the expert. Dr. Coleman, if you could follow up on that. And also, there are two different kinds of diabetes, right? And so what are they? And at the end of the day, are their complications about the same?
Yeah, so thank you so much. That's a great question. And actually, I'm here in San Diego at the American Diabetes Association. I come here every year just so I can learn the latest information that's out there. And diabetes is, we hear about type 1. That's type 1 diabetes, usually seen in children, generally. And then we hear type 2 diabetes, and that's usually we talk about we have in adults. But there actually is a third type of diabetes called MODY, M-O-D-Y. It's maturity onset diabetes of the young. Now, all three of those have a genetic component. So diabetes runs in families. We know that. Sometimes it's autosomal dominant, so that means that you'll see it throughout your family in a lot more people, or sometimes it skips a generation. It's a recessive gene. This MODY is interesting because they have very few complications. So as you know, with type 1 diabetes, you get your blindness, you get your kidney disease because it starts so young in life. With your type 2 diabetes, you get your heart disease, you get your strokes because it usually starts later in life. With your type 1, they tend not to necessarily be obese, but with your type 2 diabetes, which actually represents about 90% of the diabetes that we see in the United States, that is really a disease of obesity. And so when your body gets to a point where it just cannot, the pancreas that has your insulin, and insulin is what gets that sugar out of your blood into your cells. When your body gets to a point where it just can't keep up, that's when people's blood sugars start to go up. So when you think about diabetes, there's actually three types, but the most common one that we talk about most is type 2 diabetes.
So is there any prevention that can go on? I mean, if you get type 1, I guess you've got it. I guess you're born with it. But for type 2 and for the third type that you talked about, are there things that people can do so that they don't get diabetes?
Yeah. So again, it's knowing your numbers, having the discussion with your doctor when he does your lab test, because there's a whole set of people, about 96 million or so, that have something called pre-diabetes. So diabetes is diagnosed when your blood sugar gets to be 126 or greater milligrams per deciliter. But between 100 and 126, if your blood sugar is in that range, then that's called prediabetes. And the good thing about that is that there's been a number of large studies that have shown that if you, again, cut those portions, get your exercise, decrease the number of carbohydrates, so that's your sugars, your starches, you cut those back in your diet, you can actually reverse that diabetes and go back to normal glucose tolerance. One thing I want your audience to know is that diabetes can't be cured. It can be managed and it can be controlled. But a lot of people say, oh, well, my blood sugar's back to normal, so I don't have diabetes anymore. No. You just got it to the point where it's been controlled and you can manage it there. So the whole idea of diet, exercise, and watching what you eat, more proteins, more vegetables, less starches, rice, potatoes, all of that is what causes those blood sugars to go up.
So, Dr. Lenore, how in your practice, which is a pediatric practice, how prevalent is diabetes and pre-diabetes from your perspective? Not just type 1, but also type 2.
Well, I think type 2 pretty much parallels the number of obese children we have. I would say that probably 3 to 5% of the children that we see have some question of diabetes and certainly have prediabetes in many instances. So, and it's increasing. There's no question about it. That the incidence of diabetes, either prediabetes or type 2 diabetes in children and certainly in adolescents has increased significantly since I started in practice.
And Dr. Coleman, you began to talk about some of the medications and ways of treating it. And I know that there are a number of new medications that are on there. All you have to do is turn on the television. There seems to be yet another new medication for diabetes. Talk a little bit about them and also their effectiveness. And are there any of these medications that are more or less effective on African Americans than whites?
Yeah. I have been taking care of people with diabetes for over 40 years. And what I've seen in that 40 years has been tremendous in terms of the number of new medications that have come onto the marketplace that can really target certain systems in your body that causes your blood sugars to go up. So when I first got out of pharmacy school back in the 70s and 80s, all we had was insulin, and we had some oral pills that didn't work very well and caused a lot of low blood sugar reactions. But now, fast forward to 2023, you see these wonderful medicines that are on the television. They talk about how they affect your ability to lose weight. There's one that just came out that actually works in the area of the gut. So it decreases the ability of the gut, increases the ability of the gut to handle your blood sugars. And so because of that, it makes your whole ability to process your foods also improving. But it also has an effect in the brain. So you're not hungry. It actually affects your satiety center so that it decreases your hunger. Those are injections. There is an oral pill in that class, though, that just came out. But there are also new medicines that affect the kidneys. So they're also relatively new. And they're exciting because they've done some long-term studies which have shown that if you have heart failure or hypertension, or if you have kidney disease, these drugs are now the preferred agents that your doctor should start with, as opposed to 10 years ago, everybody started with metformin. That was the drug that everybody knows about. It's generically available and it works at the area of the liver, and it works very well. But these newer agents are really showing some profound improvements in some of the cardiovascular, so the heart issues, and the kidney issues that people with diabetes have suffered with over the years.
It seems though that in pop culture now, everything is celebrated, but obesity is now being celebrated. And I'm not suggesting that it shouldn't be. And I'm not suggesting that if you are obese that you aren't beautiful. But I'm wondering about this whole idea of the celebration of obesity. Does pop culture end up celebrating not being healthy? Dr. Coleman, what have you thought about this at all?
Yeah, yeah. There's one thing about, back in the day, they said that we were healthy. They used to call the sisters, we were healthy, right? Or big boned it, right? There's all those words that sort of described sort of a woman who was a little bit larger than your typical, runway model. But I think now this thing has gotten out of control. Everybody's beautiful, and everybody, there's someone out there who loves everybody for who they are and what they look like. But that has nothing to do with the fact that you are 50, 100 pounds overweight. And let me tell you about being 50 or 100 pounds overweight. It affects your bones, your knees, your hips. We are seeing more hip surgeries and more knee surgeries than we have ever seen as a country. It decreases your ability to get out there and exercise because you just can't walk and carry all of that weight. It also affects your heart. Just think about how hard your heart is working when it's actually beating for two people, because those people weigh 300 pounds. So that means that's 150 each. So, we've taken this thing, I think, to an excess. And I think that we really need to, as a people, as African Americans, we tend to gain weight more than our Caucasian counterparts. It's easier for us to do that, especially the women. The guys don't gain as much as the women do. So I think that it's important to, it's okay if you're overweight. It's better if you can stay within something that's reasonable in terms of your weight. But if that being overweight is affecting your blood pressure, is affecting your blood sugar, is causing you to have complications, if it is affecting your mental status, maybe you don't like being 100 pounds overweight. And so now you don't go out as much and you're not shopping as much. So you don't care about really how you look because, it's hard for you to get into the clothes in the stores. All of that it causes emotional damage to people. And that's not good. So I think that if you're going to be fat, you need to be fat and fit. And that means that the inside of your body needs to still be perfect. So your blood pressure should be low. Your cholesterol should be low. Your blood sugar should be low. And if they start to go up, then the best way to get those numbers back down is to lose the weight.
That would be a very complex conversation for a patient to have with their physician. Dr. Lenore, is that a kind of conversation for African Americans that is a lot easier to have if you've got an African American physician?
No, it really isn't. I mean, it's a very difficult set of circumstances because many times you don't know what situation that person is in. You may have a person who's overweight who's been trying like crazy to lose weight. And so what you do when you say something like that, or you say, "Are you pregnant?" Now that's the worst thing you can do. If you miss that one, then you really got hell on your hands. But it's a tough situation, conversation to have because most people, look, when you're overweight, you're overweight. You don't have to have me tell you that. What I can tell you though is that if you're overweight, that you will have certain problems, that you're more likely to have hypertension, you're more likely to have diabetes, in a very generic sense. But it's not, I see children in here all the time whose mothers are huge and they are concerned about the diets of their children. So I use that as an opportunity to simply talk about the dangers of being overweight. But it's a hard conversation, George, to have with a person you don't know where they are in that sort of circumstances.
Indeed, it is a very complex conversation. Dr. Coleman, maybe we can just sort of end on this whole idea of cultural competency and African Americans as far as the healthcare providers that they go to and how important that cultural competency is.
Yeah, I think it's critical. I do a lot of lecturing around the country, not as much as I used to. So about 10 or 15 years ago, it was, cultural competency and cultural sensitivity was in vogue. Everybody really wanted to learn how to talk to patients in a sensitive way so that they would be able to move people's behaviors. I just don't think that there's as much interest in cultural competency and health disparities as there was several years ago, and that those problems haven't gone away. In fact, if anything, COVID, I think, really made those problems even larger than they were before, because now COVID's over, but all those people who got COVID, who had diabetes and had hypertension and were overweight, all of those folks now are having some of the symptoms of long COVID. Mm-hmm. So their blood pressures are not coming down like they should. Their blood sugars aren't coming down as they should, especially folks and Dr. Lenoir is, he's an asthma allergist. I know that his his asthma patients, their ability to breathe and to walk and to do was affected by having COVID-19. So I think that we really need to think about how to improve the way that healthcare professionals and the healthcare system deals with people of color, because I don't think we're doing a good job. And I think that a lot of people are falling through the cracks. And that's what I get up every day to try to see if we can, do some of these things. And that's what we do at Healing Our Village through our website, hovhealth.com. I now have something new called Village Club, where we're able to give people a second opinion. There's a lot of folks out there who, are being diagnosed and then the diagnosis ends up not being, exactly correct. So I just think we need to do a better job as a system of healthcare. We spend more money in this country on healthcare than any other country in the world. And I just think that we should try to be doing a little bit better in terms of achieving excellence.
Indeed. Drs. Lenoir and Coleman, thanks for a great conversation with really lots of terrific information for our audience that they can use to address almost any question that they may have about diabetes. There's, of course, a lot more information on our website, aawellnessproject.org. That's aawellnessproject.org. And also, as Dr. Coleman referred to before, at her website, at healingourvillage.com. That's healingourvillage, all one word, .com. Dr. Lenoir, any closing thoughts?
No, I think that it's always a pleasure to listen to Dr. Coleman. She is one of the most experienced and talented communicators on the issue of health and certainly on the issue of diabetes. So I'm honored to be here.
Oh, thank you, Mike. Thank you, Dr. Lenoir. I think you're amazing as well.
We ought to write a song.
We do. We should do that. Absolutely.
This program is sponsored through an educational grant from AstraZeneca